In the last 4 weeks, we have lost a lot of jobs in South Carolina. The market sources coming into some of our businesses have disappeared, and they have had to close. The customers have dried up, and that has affected other businesses. And of course, there are some that we consider to be the best place to the businesses that we unfortunately decided must be closed in order to protect the public. And we've got over 260,000 people, at least that many, that as a result of all these things have lost their jobs. And the federal resources are just becoming available. The $600 that has been mentioned time and time again, that'll be supplement unemployment, ought to be in people's bank accounts or debit cards soon, if not already. But that's the beginning of that. And if I would urge everyone to go to the websites, all of them are tied in together, and find a way, if you're covered by any of those programs, and there are a lot of them, to find a way to get some resources to help you get through. But the main thing, what we hope that we can do, is we can get our economy started back again, get this economic engine going. We've tried to, and are still trying, and trying with great determination and deliberation to do as much damage as we can to the virus and to stop it without stopping businesses and pushing them underwater and into bankruptcy. Every business is essential to somebody, particularly the one working there. And so what might be essential to you might not be essential to him or her. But we want to get all these businesses going back as soon as we can. And to that end, we will be announcing before long a plan, a rejuvenation plan, a revitalization plan in order to get our economy started again. But now I can tell you that we've made a lot of progress. Our hospitals, the healthcare providers have stood up in great strength. We are prepared for the worst. We're working hard. The compliance has been good across the board in all the things that we've asked people to do, but now's not the time to let up. We have to keep on going and keep working together and following the advice and recommendations that come from the official sources. And I believe that we'll make great progress, and we'll come out of this very well. So with that, Dr. Traxler.
Thank you, Governor. Good afternoon. Today we are reporting 127 new cases of COVID-19 in South Carolina, which brings the total number of people who have tested positive for the disease in our state to 3,439. Unfortunately, we also report 5 additional deaths, bringing our total number of deaths of those who have tested positive for COVID-19 to 87. Let's continue to remember that these are not just numbers. They are people. None of us is immune to this disease, and there currently is no vaccine. The virus is widespread in our state and in our communities. Half of the counties in South Carolina have experienced 1 or more deaths among its residents. To support anticipated increases of people confirmed to have COVID-19, we continue to work with our partners, such as EMD and healthcare facilities, to stay updated on the availability of acute care beds throughout the state. As of yesterday, we are at approximately 51% capacity, with 5,748 beds available. A total of 32,764 tests have been run by DHEC's Public Health Laboratory and private labs in our state. This means that approximately 10% of tests from South Carolina residents have been positive for COVID-19. Protect yourself and others from this disease. People in our communities are getting sick and even dying of this. People 65 years and older, and those with conditions such as diabetes, high blood pressure, and heart disease are at the greatest risk. Help stop the spread of COVID-19 by staying home as much as possible, avoiding close contact with others, washing your hands frequently, and continuing to take your prescribed medications. For the latest information, you can visit our website, which is scdhec.gov/COVID-19. Thank you.
Thank you. Mr.